Guys, welcome back. Today on the PA Starter Podcast, we're talking about funny things that's happened to us over our career.
And there's a lot of funny things. There's a lot of stuff that's funny.
When you start working, students, PAs, you're going to have stories. And they're funny to talk about. As embarrassing as they are sometimes, it's what keeps us going in medicine, because medicine's a serious topic.
Yes.
But there's a lot of things that will make you laugh that make it worth it.
Yeah. Anywhere you go, if you think back to college, you think back to, hanging out with your friends or something, there's always like funny stories. But like something about medicine, maybe it's because it's analytical or it's scientific, but like the humor part of it is how we deal with a lot of things, actually.
How you cope sometimes.
Right.
There's a lot of days you come home and to your significant other, you vent and talk about sad stuff that happens. But it's the day you come home uncontrollably laughing about something you said or did or saw that I think gives you some type of drive or motivation to just keep going back because you love it.
Yeah. Yeah. So I don't mean to lead off with something to embarrass you, but Garner, hadn't really met him. We had an interview, went out to dinner with the team.
Going way back.
Yeah, we're going way back. We're going
the
back.
Beginning.
The beginning. And we hired Garner. Good dude, liked him. And he called me and he's like, "Hey man, I just had my wisdom teeth out." And I said, "Yeah, no big deal." I was like, "If you need another week or something," he's like, "No, but I've just so you know, like I'm kind of hurting." I was like, "Okay, no problem." What I didn't know, but I quickly found out, was he was on some medicine that created some problems. But I got a call from HR on his first day, and they're like, "Yeah, your PA failed his drug test." Seriously, my new PA just failed his drug test?
They wouldn't let me come to work.
No, couldn't come to work. I might have gotten like the Friday before or something. And Garner comes in, and I was like, "Okay, I don't know this guy. Like, I'm not sure what's going on. Is he a drug user, or is there an explanation?" And he comes in, and he's like, "I had my wisdom teeth out," and I call him, and they said if I had the prescription, it'd be fine. He's like, "So I knew I'd be pissing hot, but I was like, hold up, did you just say pissing hot? That sounds like street lingo. Like maybe you've been around drug tests before."
I went to PA school in the streets of St. Louis, man. You learn the lingo. These are the people I deal with.
Oh, so sorry HR for him pissing hot, but he has
honestly,
an excuse.
when it happened, I was like, I'm gonna knock it. I haven't even got my license yet. Like I was literally thinking, like, I just passed the pants. I'm coming up here.
Yep.
I think I maybe got my license, or it was in process.
It was
or
in
something.
Process. I don't know about the DEA license. What they think about
I wasn't
a drug
allowed
test.
to like touch a patient yet, but I was like stuck 8 hours from home, where I just moved to a new town, no friends, nothing, couldn't go to work, so I sat there for like 5 days.
Yeah, with hot piss.
No, and I knew I was gonna pee. I knew I was gonna piss.
In your defense, they told me they did say if you just
fine,
bring
because I was gonna cancel the surgery.
Right,
I was gonna cancel it. Like, oh, it's not a big deal. I'll cancel it, and then no, just bring the prescription. 5 days later,
we got a positive drug screen,
positive for hydrocodone
on our new hire. Yeah. I was like, "Can you go back through those? Is there any meth? Is there anything else?" That's
you guys being the best coworkers ever told every nurse on the floor, "Oh, you're the guy that tested positive." I was like, for illegal medication
used legally.
Yeah.
The best part, I think, of that whole thing was that while you were up there unable to work, we still had you take your like medical staff photo, and he was like swollen from his wisdom teeth, and so he looks like he's like flexing, and so we have that picture blown up and cut out, and we put it all over the office, and everyone's like, "Whoa, Garner's lost a lot of weight," and we're like, "No, he just let the swelling go down." So,
I just retook that picture, and the lady goes, "Did you get a new haircut or something?" I was like, "No, ma'am, no, I didn't."
My swelling's resolved after 3 years. Yeah, that was pretty good.
Yeah,
that was a good
I
one.
had another one. This is more recently that the things you get put on the spot sometimes. And you respond, and all of a sudden you realize what your response was not great.
I've been there multiple times. I'm interested to see which scenario this was.
For people in school, or that maybe don't see it a lot. The specific topic I was dealing with was a patient that had sub-Q emphysema or sub-Q air.
Oh, I know what story this is.
It's in textbooks. You'll read. I mean, you learn about it in school. It's like a Rice Krispie treat type feeling under the skin.
Like it's like crackly.
Crackly.
Yeah, crepitus.
Crepitus, exactly. Crepitus. This patient had some of it. It wasn't bad, but they were on the vent, had a lot of other health issues going on, had previously, not a thing to do with this current hospitalization, a traumatic brain injury, and had like a craniotomy. Mm-hmm. Not just like a partial, like half of the skull missing.
Yes. Yeah.
Has some sub-Q air like under their chest, so that I'm dealing with his family member who's asking a lot of questions.
And the nurses, they're freaking out. They're like, "Is this a problem? Is this a problem?" So the nurses are already nervous. They've probably been talking to the family. The family's nervous.
Yeah, exactly.
Their child can't like verbalize things,
and you're getting
everyone's freaked
these situations where you're getting a lot of questions that almost like don't even make sense.
Right.
That you've never been asked before because everyone's kind of hyped up. So the question I get is, so if that air creeps up into their face and then their head, can it compress their brain?
Yes.
Never been asked this question before.
No.
Never will get asked it again.
Very odd question. Because we will talk about, we'll say there's actually nothing to stop this air from spreading. So if whatever caused it keeps going, you can get it, your eyes can swell shut. You can hit your fingers.
And I think I actually said that. I said, he's doing fine. It's not creeping up into his face. We'll see this sometimes with their eyes swell shut. I think is how it transitioned to this question, setting myself up for this. And she says, what if it gets into his head and compresses his brain? Never been asked it before. And I said, well, the skull's a pretty thick barrier, and it should prevent that. I don't even know if that's true, but I would assume it is.
Seems like it's true. There's a skull there.
It's not like a pants question we're going to get asked.
Yeah.
And the look on her face was one I've not seen before. And she says, but what if they're missing half their skull? And I look back to the patient who is missing half of their skull, and I knew this.
Oh, man. But it's not a thing that you think about.
Not at all.
I think the look you described to me was horror on her face.
And I'm pretty sure I looked at my phone and I go, I got to take this phone call real quick. Oh, the OR needs me. And I just got out of the room as fast as possible.
Yeah.
Guy did great.
Yeah.
Did fine. If
anyone's wondering. He's doing fine. Yes.
But I walked out of that room pale as a ghost, and I remember calling the surgeon being like, just so you know, maybe set us up for a few more questions down the road.
You might want to circle back with her and just see if she has anything else. I actually had a very similar, it wasn't a half a skull was missing, but I made the mistake of going to see someone. It was fairly early in my career, and you learn things over time, right? You learn like what stuff you need to look for in the chart before you go talk to a patient. And I thought I could just go in and talk to the patient. And so I went in and I was like, hey, got to talk to you about heart surgery, going to have bypasses and stuff. And, there's some risk involved, but it should be fine. They're like, well, what are the risks? And I was like, look, looking at you, you're healthy. You tell me that you're active. I said, the only people that really have trouble with this are like diabetics. And they're like, oh, I'm diabetic. And I was like, oh, well, I like the people with like diabetes and like really bad COPD, like lung disease. It's terrible. And they're like, I have what they call end stage lung disease. And I was like, oh, geez. Okay. And I don't remember what the third one was, but I kept digging. I should have just stopped, but I just kept digging my own grave. And the patient's like, yeah, I've got that. Oh, I've got that too. Oh, I've had a stroke before. Oh, and I was like, oh no. And like the patient's spouse is like looking more and more worried. Like as time goes on, I'm like, I'm going to head
leave.
out. Just gonna
buy your time.
Gotta bounce.
Yeah.
See ya. So, Garner has had. It's the best situation is when you can watch it happen.
True.
So you kind of know, like. I don't know what it is. It's a sixth sense or something, but I'll be sitting and I'll hear one of our coworkers go in and have a conversation. And I'm like, oh, this sounds like it could be interesting. I like
it's like when it's like when you saw our coworker who is the weakest stomach, like doesn't mind, like blood's fine, but in terms of smells and like puke, poop, whatever, not dealing with it at all.
Yeah.
Learning, just got hired.
Yes,
learning.
I do remember this.
And you witnessed this. I wish I had, because now I know him so well.
Our coworker, bless his heart, this was a traumatic injury, It was a young kid, 21 years old, had gotten in a car accident, had like an infection in his chest. So we go into the lung space.
Oh, that's right.
Yeah. So the lung is pushed up against the ribs, and there's like a little thin rim of space. And if bacteria gets in there, it just starts to grow and grow and grow, and it's like full of pus, and it can be nasty. So it's called an empyema. So Google that if you want to see some sick pictures. But we had done this procedure, and the tubes just kept draining and draining, but it's pus. It's like thick, nasty crap. So every day we'd have to go in and would have to strip the tubes, and like that's like break up the crap that's filled up with the tubes. And the surgeon was like, we're just not keeping up with it. So what I want you to do is I want you to take betadine, which is like iodine, and I want you to mix it up, put it in a syringe, and I want you to inject it through the tubes to kind of flush everything out, get it up into that chest space to kind of clean everything. So he was new, and he was like, I want to do it. And I was like, oh, totally. Way to step up. I appreciate it. So we go over
Only there. Did he know.
Little did he know what he was signing up for. So he like pulls up like a stool, and he sits down. The guy's sitting in a chair. And so he like gets down to like, honestly, like knee level, like lap level. and the guy's got drains. And we've done this every day for 2 weeks. So the guy knows what's going on. The patient, he's a super nice guy, right? You know, and he's just kind of, he's just sitting there, wants to be out of the hospital. And so we're kind of making casual conversation. And Eric is mixing up the iodine solution, putting it in the syringe, puts it in the chest tube and starts to push it in. And he's like, it's not going. And he starts pushing. And I kind of look over, and I was like, he's pushing really hard. And all of a sudden it like blows up, and it, like the stuff had gone up into the tube, and then it like shot out of the tube mixed with pus now into his mouth.
Remember, this guy can't handle abnormal tastes, smells,
nothing,
textures.
Nothing. I hit a skunk with my car one time, pretended to not know what the smell was, and made him smell it, and he dry heaved because he couldn't handle the smell.
That is so nasty, dude. That's so gross. I'm gonna throw up. My eyes are watering.
So are mine. Now he just got
pus
shot into his mouth. And I start laughing, and I can't keep it in. Like I start like doing the church laugh where you're like bouncing, and then he's trying to keep it cool because he doesn't know if the patient noticed or not. The patient totally noticed and is cracking up, and Eric's trying to keep his cool. He's like he's spitting into a trash can. We finally get done with it, and he was like, "That's disgusting." And he took a betadine swab, which is like a gigantic Q-tip, and was like clean out the inside of his mouth. So gross. That's why you wear masks during a procedure like that. How about the patient that didn't seem to want to respond to you when you were asking the patient question? That was another one I got to witness. That was pretty fun.
So to set it up, I walk into a room, and patient's awake, acting normal, but like not responding appropriately. And not like, when I say not responding, not like, you know, had a stroke type response that I can tell, just like making noises at me.
Yeah.
Hello, sir. My name's Garner. I'm with Dr. So-and-so, here to talk to you about your heart valve.
He honked at you.
And I'm like, what? Like, kind of caught me off guard. Like, my fault, didn't like dig deep into his chart before I walked in.
Yeah.
And I said, do you know why you're here? And I'm like, totally like, just like, what just happened? What just happened?
And I'm sitting like 15 feet away at the nurse's station, and I'm like,
so like, you
what's
end
gonna
it.
happen?
So you
I'm
end
like eating
it, right?
popcorn watching this.
So in my mind, we're talking about doing a TAVR, which is a heart valve replacement on high risk patients. And I'm like, clearly something's up.
Yeah.
I don't know what it is.
Yeah.
Dumb me, didn't look at the chart real close, walk back out, and Chris is standing across from me, and I go, dude, I don't know what's going on with that guy.
Yeah.
But
yeah.
he clearly don't know what's going on.
Yeah. He goes, oh, don't want to talk today. Okay. And he walked in and he goes, something's up with that guy. And I was like, Garner, he had a stroke and has what's called expressive aphasia. He can't speak.
So the guy totally knew what was going on.
His brain works fine.
Totally
he just
understood.
Can't verbalize anything.
In my
Poor
mind,
fella.
for whatever reason that day, I was like, I clearly...
Yeah. He didn't want to talk to me today. Yeah. I'm like...
He's just making noises.
Oh, no.
Okay, you have to do one about yourself, because I feel like it's rip on Garner podcast.
It is Rip on Garner.
episode.
Yeah, absolutely. Okay, so yes, I started my current position with a surgeon who is known to be rather intense. And I actually used to wear a heart rate monitor in surgery because I was like, I wonder how high my heart rate gets. Because I was so nervous all the time because he was so intense. The intensity level is unmatched by anyone I've ever worked with since. But there are in cardiac surgery, there's emergent situations, there's bypass surgery and stuff like that. This one was called an aortic dissection. Which, are you on call?
I'm not.
Okay. You can only say that word if you're not on call, because if you are on call, you just screwed yourself.
And
for the evening.
they're just getting called in.
And they're probably watch it. Probably will happen. But it's when there's a tear in the lining of the aorta, and it can like block the blood flow coming out of the heart. Huge problem. Massive stroke. The aorta can rupture. It can explode basically. So these are intense situations, and you have to be
50% chance of dying.
Half the people don't even make it to the hospital. Of the ones that do, only half live through the procedure. So huge deal. And the surgeon was so like, he demanded perfection on a regular day. So when there's something that big that's going on, like you had to be on. So, and of course you have an hour from when you get the phone call to when you scrub. So I'm thinking about it. I'm like going through the steps of the case in my mind, and okay, this is gonna be okay. So we get the patient to the room and make the incision, get the saw, cut through the sternum. First thing you do is you kind of tug the sternum apart just a little bit, just so you can get a retractor in there. And the aorta tears. So we open up the pericardium, which is the sac around the heart, and the aorta has torn. And it is massively bleeding, like pouring out. Like I can't even think of an example. Like just a fountain of blood.
Bloody show. No, sorry. That's OBGYN. My bad.
So I have like a suction tip thing, and he can't see to put the retractor in between the bone to get the bone apart. So I keep sticking the sucker in there, and he keeps grabbing it and throwing it to the side, tries to get the retractor in. We can't see. So I put the sucker back in. He throws it to the side. So we're kind of fighting. The patient's like literally bleeding out on the table. And I'm like, he needs to see.
Yeah.
Like, I wish I had a second sucker. And so I stick it in there a third time, and he grabs my hands and he stops. Patient is still bleeding out. And he goes, how does your mother love you when you are so completely worthless? And I was like, I've wondered the same thing, and I'll be sure to ask her as soon as this case is over. But I was like, I was doing my best. Like I was trying to help you. And that's not the time. You don't explain anything like that. You just agree.
Don't say anything.
You don't say anything. I think I was like, I will ask. And then I was like, I don't know what to do. Like I'm trying to help. But yeah, so that's gone down in history as my favorite. At the time, it was my least favorite thing that's ever happened to me. But in hindsight, it was pretty dang funny. The patient actually lived. So
You see, you weren't that worthless.
I wasn't that worthless. I mean, I don't know. I don't know if I helped or hurt, but after about 27 units of blood, he was fine. Yeah. So let's see. What are the other ones?
I got one last one, and it wasn't me, but it's one that always comes to mind when I think of funny things that have happened to people.
Okay.
Good friend of mine in PA school who was uncontrollable sweater, hyperhidrosis.
Sweated.
To the
Okay.
max.
Okay. Oh no, poor guy.
Who, in multiple situations, any stressful situation, immediately started sweating. Put that into certain situations.
That's trouble.
And it's not great.
That's trouble. Yeah.
OBGYN. Learning how to do pelvic exams.
Oh no.
Not a great time to start pouring sweat out of your head, face, everywhere.
No.
So what they would do at our school was have a group of people come in and obviously learn your pelvic exams, learn your, prostate exams all at the same time. Poor kid is trying to learn how to do a pelvic exam.
Oh no. A pelvic exam for the students out there is examining the hoo-ha.
The hoo-ha. The hoo-ha. And is sweating all over the patient.
Oh no, that's not the time to start dripping sweat.
No, it was terrible until that person showed up again to do like the testing out.
Oh no.
I remember him coming home like, I'll never see this person again. Only for 2 weeks later, them to come back and be like, oh, hey,
Hey, friend.
remember when you sweat on me?
Disgusting. That is terrible.
And he was in surgery, which I haven't talked to him in a long time. I think he still does surgery. But when he started in surgery and he had a person that was designated to come pat his forehead during surgery so he didn't drip into the field. So it was literally
that's intense.
Every like 20 or 30 minutes, the circulator would come over and dab his head.
Oh my goodness.
Not even because something was wrong.
No, just a normal day.
Just the stress of a normal stress.
See? That's why I wear the heart rate monitor. That was my version of it. Was my heart rate gets like 190. I was like, dang, I was really intense. People are very honest. They're very honest with with their questioning and stuff like that. And it does take a lot of practice to control your reaction to it. So one that comes to mind, which is somewhat safe for the podcast. We've talked about a number of these things, and we're like, nah, can't talk about that one. Nah, can't talk about that one. But this one is pretty funny. This actually happened to my brother, who is a doctor, and he was in med school. And
so you underachieved.
I underachieved. I fell short. I'm the black sheep of the family. I don't even know what they were doing. He was in a clinic somewhere, and he had an elderly lady that came in and was like a routine follow-up. And so the doctor that he's with was asking questions. And, was like, oh, how are things going? How's your pain? How's this? How's that? And he's like, are you still on the prednisone? And prednisone is a steroid. And she's like, no, I stopped that. And the doctor's like, oh, you did? You're not, you're actually not supposed to just stop that. You're supposed to like taper off. But what happened? Did it keep you up at night, or would it make you wired, which is common side effects? She goes, no, I just couldn't deal with the orgasms. And my brother was like, what? Like, she's like 80 years old. She's like, I couldn't deal with those orgasms. And the doctor was like, okay, we'll be right back. And like, they stepped out of the room, and the doctor pulled his like script pad out, and he's like, how many do you want? And he started writing a prescription for prednisone for my brother. But like, patients say stuff, and like, they're being honest, and we want them to be honest, but sometimes you're like, what
are you even talking about?
Yeah, especially like post-op, after surgery, sternal precautions, no heavy lifting. The questions that people ask about the deed, I'm like,
constantly.
Whoa.
And some of them are normal. Obviously, it's medicine,
very
but
normal.
there are
like,
things that you get asked, or you just literally say,
okay, so I think it's a very fair thing to say. When can we resume that? Perfectly fine. Yep. I get that question a lot, and here's what we're gonna do. And I am somewhat not graphic.
Well, I had a patient one time ask me that, and the wife responded, 6 months. Oh no! I looked at her. I said, well, there's your answer, sir.
Never again. Oh gosh. No, the times that I get a little awkward are when it gets into like almost like demonstrating, like, okay, what if I'm like this and he's like that? I'm like, no, I don't need to know. I don't need to know. Just you be the judge. 10 pounds or more, too much. So if you can avoid 10 pounds, that's fine. But all right. Well, you guys will also have funny things that happen to you, and we don't mean to make light of anything that's going on, but it is kind of an entertaining part of the job of a PA, is that people are honest with you, and you are in really weird situations where stuff happens that you're like,
you could write a book about it.
Yeah.
There are people out there that have written books about just experiences.
It would be, it would be good. Hit like on this video, hit subscribe if you haven't already. We really appreciate all your support. If you have comments, definitely leave them below. We do read all of them, and we will try to respond. I will link the other podcast episodes from the past and current over there. And we'll see you on the next podcast.
Thanks, guys.